Doctors must put patients' interests ahead of their own integrity. They must ensure that legal, beneficial, desired services are provided, if not by them, then by others. If this leads to feelings of guilty remorse or them dropping out of the profession, so be it. This was written by Professors Julian Savulescu and Udo Schuklenk in a paper entitled "Doctors Have No Right to Refuse Medical Assistance in Dying, Abortion, or Contraception." Welcome to Beneath the Surface. I'm your host, Haydn Hanna, and on this episode I'll be talking with one of the co-authors of that paper, Udo Schuklenk, about abortion, assisted suicide, and euthanasia. Udo Schuklenk is originally from Germany. He studied history and philosophy and received his PhD at Monash University in Australia. He currently holds the Ontario Research Chair in Bioethics at Queen's University in Ontario, Canada. He is the editor of 2 major bioethics journals. He has written or spoken extensively on contraception, abortion, assisted suicide, research ethics in the context of global health research, and atheist values. So Udo, as I was sitting down preparing for this podcast, I decided I would make a list of all the moral issues and ethical issues that converge around these issues of abortion and euthanasia and assisted suicide. So it's quite a list. So I have the morality of suicide, ethical approaches, utilitarianism versus deontological approaches, the morality of murder, the morality of killing in general, the mystery of life, what I've termed the mystery of life. In other words, when does life begin? Is there an objective right or wrong, an objective good or evil, or is it relative? Does evil exist? What constitutes a valid family structure? How we should react to bureaucratic structures telling us to do things we don't want to do, our relationship to the law and the state, the role of religion in society, what the appropriate response to evil is, assuming that it exists, and issues of personal autonomy. Then there's problems of definition. So what's the proper role of a doctor? What's proper definition of a medical procedure? What constitutes an illness? What it means to be terminally ill? Then there's definitions of quality of life, dignity, a life worth living, competence, and what is natural. Problems with the nature of suffering, defining the many different types of suffering. Can it be eradicated? When does suffering become intolerable? And then there's perception and cognition, how we evaluate and interpret our perceptions of people, and in the context of this it would be the elderly, the disabled, the terminally ill, or the unborn. There's metaphysical issues which are underpinning all of these for the most part, like is there a spiritual underpinning to the material world? Is there a god or gods? Are they good? Are they all powerful? Are they even interested in human history or morality? And then there's problems of theodicy, which is how could a good God create an evil world? So there's a tremendous amount of substance to these issues, and they're all strong values. If you disagree with one of these things, chances are you disagree on bigger issues, and you're willing to get into a fight about this. So this list was created in about 15 minutes, and one could imagine that much more could go on it, and that the issues could be broken down and subdivided probably infinitely. So we have a finite amount of time to answer an infinite amount of questions, but as far as I can tell, that's what the human experience is all about. So let's start with, let's say, utilitarianism. And maybe just for those that don't know what utilitarianism is, or deontology, utilitarianism is the belief that the moral value of an action comes largely from the consequences of that action. It's sometimes summarized as the greatest good for the greatest number. And utilitarianism is often contrasted against deontology, which states that a rule should be followed regardless of the consequences of that action or of following that rule. So let's start with, let's say, utilitarianism as a general approach to medical ethics. I mean, what do you see as the merit of a utilitarian or consequentialist approach to these problems?
I think at this point in time it's fair to say that maximizing approaches vis-a-vis the production of particular health outcomes are actually standard operating procedure across our healthcare systems. What they're all trying to achieve is, with limited resources that we have, to maximize the amount of good health that we can get out of our investments. So what I find interesting as an outsider, still an outsider because I'm a humanities person at the end of the day, is that we have a predominant ideology in the medical profession that is deontological, and a practice that ultimately, consistently is utilitarian. And this is somewhat hypocritical. But this, I think, is the value, actually, of utilitarianism, that it allowed us to develop methods, most frequently used in health economics these days, to actually measure how good we are at achieving those desirable health outcomes with the limited resources that we have.
So with any approach to ethical problems, there's some critique. So with utilitarianism, say, the big one that seems to come up over and over again is unintended consequences of actions, right? So a lot of people sort of critique maybe legalizing, say, abortion or euthanasia will create some sort of slippery slope that will lead to worse things. So I know you've addressed some of this in articles and things, but in general, how do you deal with the threat of unintended consequences as a utilitarian or as a consequentialist?
Well, there's nothing different as a matter of fact, to people in any other ethical theory that is at all considering consequences as being relevant to the evaluation of particular actions. And for that, you don't have to be a utilitarian. People in virtue ethics would not say that the consequences of actions don't matter. And I think even for most Kantians, the idea that consequences don't matter at all probably is ludicrous. So that problem is not unique to utilitarians. And the long and short of it is really that all you can do is you can rely on the existing evidence and try to extrapolate from the evidence or from historical experience, for instance, on what risks are, and on that basis you make decisions as to whether you proceed with particular causes of actions or not. We have this, and again, you don't have to be literally. I'm tempted to say forget about utilitarianism, because when you think about research ethics committees today, all the time they are being asked to make a determination with regard to the balance of potential benefits and the balance of potential harms, which is nothing other than looking at risk and probability and then make decisions. So I'm not sure that is a unique challenge to utilitarians, is a unique challenge to any kind of human action, really.
So one of the things that I've personally noticed about the euthanasia movement, say, and the abortion movement, is that they target very specific types of suffering, and largely medical suffering, or suffering having to do with disability. So could you maybe answer either why has or why should these things target this type of suffering versus other types of suffering, like, say, the suffering of war, the suffering of losing a loved one, or existential suffering, or those types of suffering?
You're right. I mean, I think this is a very good question you're asking, because when you think about what euthanasia means, it simply means good death. So there's nothing in that wording that suggests it has to be limited to the practice of medicine. Today, at least, I think a decision was made, and I think it was a strategic decision. I was not involved in that decision. I don't have to defend the decision. To focus on ending of life involving, in the context of healthcare. In other words, the suffering that is visited upon individuals as a result of disease conditions that they are suffering, leading to a life that they do not consider worth living. That, I think, is what drives or what motivates today people in what you call the euthanasia movement. But I do not presume to speak for that movement. I couldn't. This is a very diverse group of people. And the idea then is, of course, once you talk about this in the context of healthcare, you talk about it also in the context of a profession that is super highly regulated. And this is probably seen by most of those people in that movement, as you call it, as a kind of safety belt. It's not like some random person killing people, but it's actually people that are super specialized, that are super regulated, that are super monitored, and this gives us a lot of safety and security when you think about policies that you would introduce, as we have done now in Canada, that actually permits medical aid in dying. And this is what is medical aid in dying, not aid in dying, where you and I go about and kill people and say, yeah, but they asked us. This is not how that works. And again, then there are also safety belts that look specifically at the question of whether these people are competent, whether the disease condition is irreversible, as opposed to somebody feels shitty because the girlfriend or boyfriend broke up with them and they want to die. We know that that will pass. So there's no reason to act on these sorts of requests. And all of that really, I think, explains why the focus is on the healthcare field as opposed to any other field.
So in Canada, I mean, I guess just a follow-up to that question, I mean, there are certain situations where if someone says they want to kill themselves, in one set of circumstances, the appropriate reaction is to try and prevent it. And then in another set of circumstances, the appropriate reaction is to assist them. And so I guess the thing I struggle with personally is trying to figure out what exactly that line is and what it's based on. Because what I see is it seems to be fairly arbitrary, and it seems to be based on people's conceptions of what human is or dignity. It seems to be very idiosyncratic. So,
and again, I mean, I do not presume to speak for any other people that are in favor of medical aid in dying, for instance. I am very ambivalent about the societal response to suicide generally, because I think that there are situations where people commit suicide for very good reasons, their reasons, but reasons that I would fully respect, and where I think, if I was in that situation, quite conceivably, if I had the means, I probably would have also ended my life. While our gut response is prevention, counseling, holding hands, preventing from, but this seems to be more about people who care about these people and might be hurt by their absence as opposed to these people themselves, because unless we at the same time were in a situation where we could render their lives worth living for them, I think it's a staggering arrogance to tell them, but you must not do that. In brackets, that I think is also the reason, of course, why suicide is not illegal in this country. We do respect people making those choices, and in brackets, and then we don't. So I think prevention efforts should focus on suicides undertaken by people who a week later would likely regret it. And again, this is where I chose the example. First-year students having their first relationship break up, and they always break up. It's probably fair to say if any of them snapped and tried to commit suicide, we should do everything we could to stop them from doing that. If, on the other hand, somebody who has intractable depression and has gone through all treatment modalities that we have available in our healthcare system and nothing worked for them and their life is absolutely miserable, I think, who are we to tell these people that they must not do this and suicide is always wrong? It's just an arrogance that I really think is mistaken.
You're claiming that basically the individual gets to define what a life worth living would be, their particular life, right? So one of the arguments that has been presented to this is that when one person claims that a life is worth living, then it might cast a shadow on other people with that particular, condition or disease or what have you. And sorry, I'm going to jump from the euthanasia topic to the abortion topic, but I think there's some overlap between these two issues in that they both talk about what constitutes a life worth living. So let's say someone decides that they're going to abort a fetus they discover will have Down syndrome. Does this not cast a shadow over other people with Down syndrome because they're effectively claiming that they don't want that person in their family, say? The thing it reminds me a bit of is in the the racist movement way back in the 60s, you say well, black lives are okay, but I don't want them marrying my daughter,
Yes.
sort of thing.
I'm afraid I have to start somewhere else in answering your question. I cannot, because that question to me would accept premises I do not accept in the first place.
Go ahead.
So, because the first question I think that one needs to address is whether abortion as such is morally problematic. If you reach the conclusion that, say, prior to viability or even prior to birth, abortion is morally neutral, as I would think it is, and it's up to the woman to decide whether or not she has any particular child, then of course you have to bite the bullet and to say, well, because if I already grant her that this abortion is morally neutral, then surely I cannot turn around and say, this abortion is morally neutral unless the child is disabled. That is bizarre. So, on the other hand, for instance, I would not bat an eyelid if the child was perfectly healthy. That's ridiculous. Mm-hmm. So this is why first I think you need to contest the morality of abortion as such. Once you accept, though, the claim that abortion is not morally problematic, and this why in Canada, for instance, as you know, abortion is legal at any point in time prior to birth. Technically, of course, in the last couple of weeks of a pregnancy, it is exceedingly unlikely because there's also risk to the pregnant woman and so on and so forth. Having said that, I actually do appreciate the argument that people might be concerned both about what that means for other people with that disability. You look at other examples. For instance, we know that in certain ethnic communities or cultural background of certain cultural backgrounds, we have a higher percentage of abortions as a result of the biological sex of the fetus, female feticide, right? But there the same argument is applicable. So my response to that would be, we probably should do a better job to explain to these people why these sorts of choices are not very sensible, by pointing out that people with Down syndrome, based on everything we know, live very happy lives. It might be more labor intensive for you as a parent to have them, and maybe you decide on those grounds. But do not pretend it had anything to do with the child's well-being, because these children are fine and happy. That is not an issue. And the same would be true for females born to people from cultural backgrounds where they are not as highly valued as male offspring. But really, the initial argument needs to be about whether or not abortion is ever wrong. If your answer to that already is no, it's up to the woman, then you cannot turn around and say, yeah, unless they're disabled, it makes no sense. So one just has to accept that consequence, and I'm happy to accept that consequence.
Okay. But is not the woman's intent, or say the motivation for the abortion, not enter into the moral arena at all for you? I mean,
no. If I deny that fetuses have moral standing, and if I'm successful in defending that view, then it does not matter whether they want to go skiing, or they don't like the color, or they don't like the sex, or they don't like the disability, or they don't like the potential height, or whatever else it might be. It's completely irrelevant. And that is not to say that I would make that choice, or that I would think they should make that choice. But what I would always say is that it is their choice. I mean, the central question is, what confers moral standing? And my view is moral standing requires a number of dispositional capacities that fetuses don't have. And again, I mean, that is controversial, but I think at this point in time, I think at least in Canada, it's fair to say it's very much in line with regard to where the law is, or more to the point, the absence of abortion-related legislation.
Hey guys, sorry for interrupting the podcast. I just wanted to remind you that Beneath the Surface is on Instagram, Facebook, and Twitter. If you're enjoying this podcast, please consider becoming a patron on Patreon. This podcast is completely free and is supported by patrons. Now back to my conversation with Dr. Udo Schuklenk. So let's talk a little bit about the role of religion in society and medicine in particular. So I should start by saying I'm not a religious man, so I'm not trying to push any sort of religious agenda, at least not consciously. So obviously the opposition to abortion and contraception and euthanasia at least seems to be largely a religious one. Would you agree with that for the most part? Yes. So I guess as an atheist, should we discount objections based on religious grounds simply because they're religious? I mean, I guess the examples I'm thinking of is, back in Nazi Germany, there was some religious movements against euthanasia, the euthanasia program as Hitler envisioned it, and also like the Jehovah's Witnesses and the concentration camps have been documented to do some fairly, they ended up being on the right side of history. And I guess, can we discount Catholic objections when there have been some instances of them being on the right side of history in the past? And I'm not saying that it had something to do with their Catholicism or their religion. I'm just saying...
No, you must claim that, otherwise the question is useless to ask. Well, because if that didn't motivate them, then you don't have to bring it into the question.
But what I'm trying to argue is that their Catholicism is actually indifferent to their moral standing, which I think is actually, perhaps we would agree on that the religion does not have an effect on a person's morality.
What do you mean with personal morality? Their moral convictions are significantly influenced by their religious beliefs. Absolutely. There can be no doubt about it.
So when you hear a Catholic objections, do you automatically discount it on the basis of we have different metaphysical backgrounds, and therefore whatever follows from whatever their beliefs are will automatically be incompatible with mine?
Well, for starters, I would not think of the objection as a Catholic objection at all. It's pointless to label these things. You look at the argument, and if the argument is not a public reason-based argument, then by definition it's not an argument relevant in the public domain. It's not an argument that is accessible to anybody and everybody in society, but only to people who share those particular beliefs. That is only suitable for governance in a theocracy, but not in a pluralistic, multicultural society. So this is why the agreement really is, and you can see this in fact when you look at the arguments brought forward by, of course, all these anti-euthanasia people, most of which in fact were religious people, and most of them were in fact Catholics. That they went out of their way to ensure that their arguments were not coined in religious terms. They were coined in terms of public reason-based arguments. And these are arguments that you can debate. And the arguments that they brought forward were to do with human dignity. They brought slippery slope arguments, which are arguments that are testable, eminently testable. And I think they deserve credit for that, because they appreciate that if you live in a society like ours, these are the only kinds of arguments that count, and they adjusted to that because they understood that otherwise we can't have a meaningful conversation. So I think we have moved. We are in the right direction we are in the right ballpark as far as public conversations about these issues are concerned. And I would certainly not discard any of their arguments just because I know they are religious, because they are still sound. They are still testable. Not sound, but they are still testable. That's the point. They can be analyzed, they can be critiqued, and at that point, they are valuable for the conversation. And so I never denigrated them, saying you're Catholics, stupid, forget about it. I mean, this is not how you deal with that. If on the other hand they said, my God thinks this or that, then I would think this is pretty ridiculous, because A, we don't know whether your God exists, whether these are really your God's views, and even if all of that was true, why should I care? Because it's not my God. But give him credit, this is not what they have done. This is not the level of argumentation that they have put forward, and so I don't think it's an issue for all practical intent and purposes anyway.
That does answer my question. Okay, so let's move on to the issue of conscientious objection.
Yeah.
Thank you. And just so people know what we're talking about when we say conscientious objection, there's this idea in the medical profession among those that don't believe euthanasia and abortion and assisted suicide to be moral, that they should have the right to opt out of providing those services for people. So I'm going to put the question to you because one of the arguments I read in a recent paper was that conscientious objection is not a suitable response from people that believe that abortion or euthanasia or contraception are in fact evil. There's something, they should just be not involved with the medical profession in any way if that were the case. So I guess I was wondering if you believed that abortion and euthanasia and contraception was in fact evil, what's the proper response to a medical profession that seems to be moving in that direction?
To the profession or to the objector or to whom?
So if you believed abortion or contraception or assisted suicide was in fact evil, if that was your position, yes, what's the appropriate response to a medical profession, we will say the profession, that wants to legalize that, all those things? Or maintain the legality of the things that already are legal?
It's no different to asking somebody whether they should work in a butcher's shop when they're animal liberation people. It's not a profession for you. Find a job that you want to do and do not join a profession that has a particular scope that you're aware of. And then and worse, when it comes to the medical profession, you also have a monopoly on the provision of these services. So you have a societal monopoly. You join the profession voluntarily, you know what the scope of the profession is, and then you turn around essentially to give society a middle finger and tell them, but I'm not going to do this because of views that have nothing to do with the profession, that are idiosyncratic, private views, the validity of which cannot be tested in the sense of, I cannot test whether you hold the views, the reasonability of the view cannot be tested. So we can neither test whether it's sensible that you hold, that the views themselves are sensible, nor can we test whether you actually hold the views that you claim to hold. And on that basis, these people insist that we should accommodate them. And I don't think we have any reason to do that at all. And as it turns out, in the most recent court decision, which is in Ontario, I think it's a Superior Court here in Ontario, the decision was made now that conscientious objectors, in this country at least, must provide an effective referral. Effective referral means you need to pass this patient on to somebody who you know will provide that service, and you need to facilitate that. That is very significant because, ask yourself, if you were the objector and you thought there was murder, the contested action, and now you have a court decision telling you basically you don't have to commit the murder yourself, but you have to ensure that the murder is committed, you would not think that's a compromise by any stretch of the imagination. So again, my view on this is, and I said it in various papers, is that nobody forces you to do this job. If you don't want to do the job, though, get out of it. But you cannot cling to a monopoly. You cannot cling to being a monopoly provider for these services and then refusing to provide them on grounds that are not professional grounds.
So in the medical profession, so one of the arguments you make is that people that aren't able to commit to abortion or euthanasia shouldn't join the medical profession. Okay.
I mean, I have to be careful. You could decide to go into dermatology, but please do not go into gynecology if you don't want to provide abortions. It's ridiculous.
So to a certain extent, I mean, you also don't want to create sort of like morally homogenous bubbles.
I do.
Say.
I do.
That's the
whole point of having a profession, my friend.
So, but how does one maintain the ability to be critical in this situation? I mean, shouldn't you always be wondering whether euthanasia and abortion is moral? Even if you believe in it, you should always be.
Let me give you a couple of counterexamples. Should somebody who is a surgeon continuously think about whether blood transfusion are a good or a bad idea and maybe just leave it sometime because they have beliefs that are religious? Do you think that an oncologist who also kind of fancies homeopathy, that every now and then just switch to some other regime and see how that goes down with people? Probably not. So in actual fact, the definition of professionalism is that you provide a particular standard of care, and that's a clinical standard of care. And no, it is not a random and a free-for-all depending on what other non-clinical beliefs you hold. This is not what should ever guide this thing. Having said that, that is not to say that these people are not well within their rights within this society. to run an argument that euthanasia should be abolished, that abortion should be criminalized, that gays should not be accessed to in vitro fertilization, whatever it is. That's the nature of a democracy. But this cannot be fought out at the bedsit when a patient needs a particular service that they're entitled to. That cannot be. So no, I'm not a liberal there. No. And if you are a patient, funny sideshow. And if you ask patients, you will discover that they actually agree. The only people who don't agree are doctors, because despite their promises to serve the public good and patient comes first, a lot of them, when it comes to their idiosyncratic private convictions, they think this is more important than anything in the world, which I think we as society are well advised to stop that right in its tracks.
So at the beginning of this discussion, I presented a list of all the issues that I think converge on these topics. And when I look at this list, I think, well, geez, if I'm wrong about even one of these things, like, it just destroys my entire argument and my position. Mm-hmm. Do you ever get that feeling? Do you ever fear that you're wrong, or you might end up on the wrong side of history? Because I always feel that in my personal beliefs, that, geez, if I'm wrong about this, it's a big deal.
I think the older I get, the less worried I am, because you have these arguments tested on a daily basis. And at one point, you realize that, from my perspective, these counter-arguments, a lot of the times, are really shitty arguments. And I can't put it in other terms. That's not to say that tomorrow there might not be some devastating argument that kills everything I always subscribe to. But if that's the case, that's how progress operates. And there's no shame in acknowledging that you're wrong. And I have acknowledged, in fact, that arguments that I published before were wrong. And in fact, I put that in writing in other journal articles and said, actually, this counter-argument has persuaded me. And what I said at the time was wrong. And this is the reason I was wrong. And this probably only goes to show that even in the humanities, there's progress.
Dr. Schuklenk, thank you so much for talking with me. It's been a pleasure. And
thanks for your time. Thanks for having me.
Thank you. Hey guys, thanks for listening. A reminder that Beneath the Surface is on Facebook, Instagram, and Twitter. If you enjoy these podcasts and want them to continue, these podcasts are completely free and run totally on the donations of our patrons on Patreon. So if you'd like to support this podcast, consider becoming a patron. Thanks again for listening to my conversation with Dr. Udo Schuklenk, and I'll see you next time.